Welcome to my viewers. I am Dr.N.SUKUMARAN, continuing with the episode, The Health is Your Birthright. Today's my topic is on liver. Before starting the subject, I shall tell you about an incident, an anecdote, which is related to the liver patient. One day night, I was called up and number of people with a patient was on my doorstep. He was under the treatment for his liver complaints for quite some time, and now the situation has gone very bad. His doctors advised him liver transplant, which was very much beyond their capacity, and he was not willing to undertake that kind of a risky affair. Hence, for a second opinion, they were here. Now, the promise of his hospital was that if a liver transplant takes place, he can live very happily at least for 3 years, if not 5 years. So, he was not willing to spend the type of amount they have quoted. And to cut the story short, today more than 14 years are over. He is enjoying a very healthy life like me and you. So let us start on liver. Liver, the largest internal organ, and its functions are numerous. It is a very big chemical factory, the type which we have not seen anywhere, even in the mechanical or industrial world. Main functions among these more than 500 functions comprises of production of bile, excretion of bile, production of cholesterol, enzymes, regulating nutritious contents of the food received, glycogen management, and a number of similar functions which are absolutely essential for our healthy living. The safeguard includes self-healing mechanisms. In spite of that, number of liver complaints are coming in the day-to-day treatment I am conducting. And majority of them are related to type A, B, C, D, E hepatitis, jaundice, this fatty liver grade 1, 2, 3, contraction of liver, swelling of the liver. But among all, the most disturbing is cirrhosis of liver and cancer of liver. Yes, it is self-healing, I told you, but we have to create a situation for the liver to sustain itself, to heal itself. Here comes the importance of treatment. Now, what are the symptoms? Varying symptom picture for at varying degrees are visible for almost all liver complaints. Main among them are severe fatigue, weakness, blurring of vision, sleeplessness, abdominal discomforts, yellowish urine, skin, and eyes. Once bilirubin is more than 2 in the system, then obstructive jaundice, which creates also the itching over the body. There will be itching in the soles of the feet and in the hands. Then discomfort can be there for eating and aversion, severe nausea and retching. The stool could be yellowish or whitish in color. But number of people suffer from shoulder pain or the right side or the pain over the scapulae, which people might mistaken for rheumatic complaints. But it is due to many a times the liver complaints. For many people, fatty liver grade 1, 2 or 3 are reported, and in the earlier days it was primarily due to excessive drinking, but now it is overtaken by wrong use of certain medicines. Okay, medicines if can cause cirrhosis of liver, perhaps we may have to think twice before taking any particular medicine. Bad food habits, ready to eat food available are also a cause of concern. Yes, we can manage this. Once we are aware of it, we can control it. But then we can take the horse to the riverside, but drinking of water is horse's responsibility. Many a times patients do deviate from the instructions they have heard from the doctor. Now, the fatty liver invariably lead to cirrhosis of liver. The scarring takes place and self-healing stops, and the patient will have no option, and ultimately the doctors will have one option, that is fatty liver should be replaced by a very nice liver if available, if and when available. In almost all my episodes I have emphasized the importance of food habits. Here too I will have to emphasize on the food habits. One must eat easy to digest food, especially in the case of liver complaints. And adequate water means proper hydration is a pre-requirement to save your liver, because all obnoxious materials has to be thrown out. It is mainly ultimately due to the kidneys job and resulting in proper urination. You create a condition whereby it can do its designed duties. Now, the liver should not get too much fatty food. We have to restrict. Once one is aware that liver problem is around, the first and foremost is to cut down on fat intake. It does not mean you have to starve. Many other foods are there which you should take, because liver has to repair itself. For that, nutrition is needed. I am not of the opinion that one should not be allowed to eat properly, or one should completely avoid of non-vegetarian items or normal food item one is habituated with. Like you can have idli but not vada, you can have chapati but not puri, you can have potato curries but not potato vadas. One can have lean fish but not fried ones, curried one with less masala. And Similar restrictions will be throughout the food regimen. But emphasis should be given that more of light proteins are given to the patient. Lot of fresh vegetables, and mainstay for all sort of fruits, especially which are slightly sour in nature. It appears that one glass of lime water early in the morning is very pacifying stuff for the liver, and strictly avoid alcohol naturally, and all the other sorts of medicine we may have to stop till your liver is back to near normal. A clean environment is a prerequisite to prevent liver compliance. Most probably it is the water, contaminated water, which is causing the normal A type and E type of hepatitis. Here, very fine drinking water is the requirement, and it is our solemn duty to see wherever we stay, it is kept clean. The environmental cleanliness is every citizen's responsibility. It can save so many people from this dreaded liver compliance. Similar situation is there where people are exchanging their needles, especially the drug peddlers, which is causing the problem for hepatitis, especially hepatitis B. Then blood transfusion in hospitals, then relationship copulation with unknown people, then overuse of medicines which very clearly cautions against the liver. All those things should be taken note of, and taken note of for implementation, not merely taking note of. Other than various mode of infections, overeating or eating unripe fruits, uncontrollable anger, all these can lead to liver compliance. Yes, these are all the things we can control. Let us see what we were doing in the olden days as well as today. In my younger days, I have never seen a person approaching a hospital for jaundice. Those days, this hepatitis A, B, C, D, E, compartmentalization was not available. It is jaundice. And I must say, I have not seen a single case going bad due to jaundice. They were more relying on ethnical medical plants, especially this Kidarnalli. This Kidarnalli is known as Bhui Avla in Sanskrit as well as in Marathi, and its Latin name is Philanthus nerudi, and a similar number of medicine. There are more than 100 medicinal plants are listed, and its efficacy is known. But don't ask the question about the proof. Proof is in the pudding, nothing else. People are getting cured. That's important. Now, in homeopathy, we do have a lot of medicine, and we don't treat for cirrhosis of liver, jaundice. What is the symptom? And the symptom will decide, plus the proper evaluation after proper questioning by the homeopath will decide the medicine. and if properly managed, properly explained by the patient, properly understood by the homeopath, there the medicines, the lot of medicine, a plethora of medicines are there to help the patient. Definitely, it will not fail. The main among them are certain mother tinctures, that is chelidonium, aspidosperma. When there is disturbance in getting oxygen due to engorgement of the abdomen and the consequential impact on the lungs. Then there are cyananthus, cyananthus, cardasmer, the most important one, given for the cirrhosis based on the symptoms explained. Carbovegetalis, Nux vomica, China, Crotalus H, Natrum more. Oh, there is a long list of medicines. Don't get bothered or scared. Approach your nearest homeopath. He will definitely help you. Gentlemen, we talked about the symptom picture, the disturbances what one encounters, and the possible ways to prevent those things. These are very important. We have to individually observe and also plead to the people to observe those things so that we are a liver trouble free society. Now, hope in the nutshell you have understood what are the problems and how it can be solved. Next episode again I shall come. This time it will be based on the request again, that is how to take care of the small children. Yes, they are the responsible citizens of tomorrow. We have to take care of them. We shall see next time. Till then, Dr. Sukumaran. Thank you.